Healthy teeth and a great smile can make anyone feel confident. Dr. Fahmy specializes in cosmetic dentistry, and he'll explain how to make the best choices for your smile. Bear, thanks for coming on.
Larry, it's a pleasure to be here.
Now, for full disclosure, you've been my dentist for a number of years and was absolutely painless, except when I got the bill at the end. That was the only pain I felt.
Sorry about that.
No, it was very good. It was great. You know, they say that the eyes are the window to the soul, but it's really your smile. I mean, it means so much to a person, how they do in life and how people perceive them. Why don't you start from the beginning? What is cosmetic dentistry? And then you can show us some of the things you have here.
Sure, Larry. Well, the cosmetic dentistry is the art of making teeth look great. Basically, it depends on every person. What are you looking for? Do you want to have perfect teeth? Do you want to have them a little whitened? Do you want to have them a little straightened up? It really depends on everybody. There is a variety of things that can be done. Like maybe sometimes it's a little filling that I can put on a front tooth that's chipped, that's going to make a big difference. The newest trends now are catering towards not drilling too much on the teeth. Preserving the enamel of the teeth and preserving the teeth itself is very important. And that's what we're trying to always achieve here, to do something that will not mess up our natural teeth.
So the old days of pulling out all the teeth and putting in dentures are over.
Are gone, way gone. And then now if you have to pull a tooth, of course there is always the implant that can be placed and a nice crown on it, and people would not even know that you're missing a tooth.
I noticed that, you know, everybody wants these big white piano teeth, and then they're sorry afterwards, and you always kind of guide a certain way.
Definitely, definitely. I always talk to the patients and explain to them the difference between having the piano teeth or the natural teeth. Yeah. You want to have a natural look. You don't want people to be telling you, oh, what is that? Is that a denture? Are those crowns? You want people to tell you, oh, what a beautiful smile. Yeah. So every person is different. Yeah. Every complexion is different.
Okay, Bear, so we have a various types of teeth there. Can you tell us about the first one here?
Well, the first one is what we call the no prep veneers. It's the simplest and the newest trend. You don't really have to shave the teeth. All what you need to do is clean the teeth up, take an impression, send it to a specific lab that do those, and then they come back very thin, strong porcelain shells that goes on the teeth. So basically, this is a procedure that doesn't need the patient to be numb. We go ahead and glue those veneers on your natural teeth. Again, it takes about maybe a couple of hours to do that procedure, and then the patient have perfect teeth. They look great, they fit great, and
those are beautiful. Yeah. So you can do no prep because the teeth are basically pretty good. I mean, they don't have a crown on them or something.
True. If there is a crown or an old restoration that is not a good restoration, we need to remove it and put a new one that's better looking, especially if it shows like a black line or something like that underneath. But if the teeth also are a little crooked, you can do what we call a cosmetic contouring, which is not prepping the teeth, not removing too much teeth, but just adjusting it so when the final product is in, it looks perfect.
So if the tooth is a little crooked on one side, you would build up the veneer on one side to make it look straight?
Yes, on the side that's going in.
Rather than putting like a brace on or something and straightening it.
Yes, we don't really need to do braces at this point. We just need to do, the veneers will be a little thicker on the side where the tooth is in, and a little thinner on the side where the tooth is out. So at the end of the day, you're going to see that evenness of the teeth and the way they should look, the natural look.
So are these veneers like new technology that they could be so thin and so strong? Is that why
Yes, it's been around for maybe about 10 years. Yeah. It was there before, but this is the newest trend where they can get them, they try to get them a little more thinner and a little bit more stronger so they would last and the patient doesn't break them on the first time he tried to bite into an apple.
So they have to be extremely thin if you're not, so they don't stick out.
Exactly, so they don't look fake.
So now they're thinner and stronger, and is it the material different than it used to be?
The material is a little different, yeah. It's a little stronger. There is a little bit more better technology in it than the old ones. That's why we don't need to make it as thick.
Is it more expensive because of that technology?
It is still a little bit more expensive, but it's getting, it's getting around, lots of labs are doing them, and it's going to get a little cheaper as
the competition comes up.
Competition is going to be better.
Now, and then the more extensively damaged teeth would require you to shave them and...
Yes, this is the old way of doing crowns or veneers. Then we have to do it, but we really in most situations, this is doable still.
Yeah.
But I mean, again, if the tooth is broken or have a root canal, I have to do a crown. But if the tooth is reasonably, chipped, or in fact, I have a case here that I can show.
Sure.
That have a patient with broken teeth, but they were not that bad where I have to do crowns. Or what I did is I adjust them a little bit, take an impression, and then I got the no prep veneers on the teeth.
Wow, that's an amazing difference.
And it looks a lot different. We changed her life, basically.
Yeah, that's dramatic. Wow.
So, and there is also another one that his teeth was very discolored. He didn't like the discoloration.
Yeah.
So sometimes it's about the shape, sometimes it's about the color, sometimes it's about the crookedness. But in fact, all three can be handled nowadays with those no prep veneers.
So years ago, you would have to put dentures, braces on that, and they would be on for years and years to bring the gap together.
Yes.
Now they walk in there, and a couple of weeks are done.
In most cases, yeah. So the other option that we have, if your teeth are too crooked or you don't want to put anything on your teeth because they look great and the color is fine, is to do the Invisalign. Invisalign is a form of braces. It's you just wear it every day, throughout the day. You take it off when you're eating, and then you put it back. This is another way of straightening up the teeth. And again, it's pretty simple, and it works perfectly for lots of patients. But again, not everything is for every patient.
So do people still use the wire braces then?
We still do. We still do. The wire braces is quicker, and usually the orthodontist would like to give it more to younger crowd, because this have to be handled very diligently, but the braces are easier to.
This requires more care.
Yes, definitely. And the other one moves the teeth a little quicker than this. And it's also not just that. The wires are usually for complicated cases.
I see.
This should be an easier case where you get the clear.
Those are nice because you don't even see them really.
So, yes, you cannot see them.
And then you have one other item over there.
Now this is a really interesting new concept where if somebody have some missing teeth and then is waiting to get his veneers or implants or replace the missing teeth, and he wants something right now, because I cannot go like that because I'm a professional or I'm working. People are not going to accept me like that. So what we do is we take an impression, get this little appliance, which just goes on the teeth. It snaps on the teeth, which is pretty interesting, and it looks pretty great.
And that's strong enough to eat a regular meal and stuff?
Well, not everything, but you can if you're outside and eating with people, of course you're not going to take it off, but you have to watch out not to eat anything hard.
Really be careful with it.
Yes.
So you're not going to eat like a candy apple or anything?
No, not that hard.
Right. So with this, you're still doing other things. You're planning on putting the new teeth in, you order them or whatever.
Yes.
And this makes everything look nice.
This is a temporary situation that keeps you in a reasonable shape until whatever is going to be done is planned and done. It takes about a year.
So you have a lot of options here, and I guess you can tailor to the person. You can show them the before. Can you show them what they may look like? Can you take a picture of their bad teeth and say, this is how you're going to look?
In fact, yes. There is now a new software where you can take the picture of the patient and then run it through that software, and it will tell you how you would look like after the work is done. It's not exactly what you're going to look like, but it's very close. It would be like 80–90% close to what you would really look like afterward.
So the days of the old fillings and the gold teeth are gone for now. But as far as cavities go, I have one question. So if you have the veneers on, does that trap bacteria so you get more cavities or no?
Well, technically not. If it all depends on how your oral hygiene is. You have to still be flossing and brushing like you used to. This is very thin, and the space between the veneers and the teeth is minor, and it's always filled with a very strong cement that holds the veneer to the tooth. So if you're flossing normally and brushing normally, you're going to keep it in a good shape. If you're not, you're going to get a cavity like everybody else.
And if you have a cavity, you could, your x-ray will go through that veneer so you can see there's a cavity underneath.
We can fix usually most cavities while the veneer is still on, which is really interesting, unless you waited and the cavity is huge. At this point, we have to remove the veneer and fix the tooth and then maybe put another veneer on it or a crown, whatever it is. But usually, if you're seeing your dentist every 6 months like you should be, these things should be cut very early, fixed very simply, and you don't have to worry about it.
You're trying to tell me I don't go see you every 6 months? It's a little dig.
That's a little hint.
Anyway, this is a great topic. I hope people learned a lot, and there's a hope for everybody, really.
Definitely.
And
Definitely.
It was really great. Thank you for coming on.
Pleasure.
Appreciate it.
Thank you for having me.